Right now, districts all over our area are releasing their back-to-school plans, including their policies and procedures for protecting students. As Jordan Vandenberg explains in this Rebound report, some are using a playbook provided by a local hospital.
Children are our greatest resource, and educating them will always come second to protecting them.
Everybody's learning a new busy.
This is actually always a pretty busy time for superintendents.
Chagrin Falls Superintendent Dr. Rodney Hunt and Cleveland Schools Chief of Staff Karen Thompson are just two of dozens of administrators piecing together plans for the upcoming school year. Many districts are considering three options: all virtual, all in person, or a hybrid of the two. The plans will be as unique as the districts that adopt them.
One of the better things we did early on was, rather than start talking about models, we talked about what are our kind of beliefs, what are our kind of guiding beliefs in this process. And obviously safety of students and staff was one of the first things that we came up with.
This is not a one-size-fits-all approach, and also our approach has to be flexible depending upon what happens with the number of cases in a community, depending upon the school's ability to adhere to the cleaning guidelines, the distancing guidelines.
Dr. Joan Zoltansky, the head of University Hospital's Healthy Restart team, was their guiding light. She and her team toured different schools in different districts, setting a syllabus for what education in a pandemic may look like.
We have a phrase in our system: screen, clean, 6 feet in between, and the masking. So those are really the four verticals that we keep going back to.
In Cleveland, the Healthy Restart team toured John Marshall High and Garfield School. The team provided district leaders with practical, easy-to-implement solutions to keep kids safe.
I can't underscore the importance of having that physical walking of the building that we wouldn't have thought about.
In UH's Healthy Restart playbook, the team recommends changes like 6 feet of separation between desks, staggered locker assignments, and checkerboard seating at lunch. But in a living organism like a school, there are always what-ifs.
We recommend not sending a student to the nurse's office. The nurse's office should be a place where you get your regular asthma medicines, where you would get your headache medicine, other medicines like that. But if someone were to have those symptoms of COVID, that there should be a special place for them.
I think this isn't just about opening a school, it's creating an environment that you can stay open. I think mitigating some of those risks, the more you can mitigate the risk, the better your chances are staying open.
Dr. Zoltansky says it's likely that these necessary changes may scare some young students, and that's why communication will be key. Children are our greatest resource, and it's a resource worth protecting.
I'm passionate about patient care, but I'm also passionate about the care of the nurses that provide that care, about the environmental service worker that goes in and cleans that room, and we have to have the same conversations in our schools.
The Healthy Restart playbook can be found on our website, news5cleveland.com. In Cleveland, Jordan Vandenberg, News 5.